Hi there, welcome to the MBA 622 Comprehensive Health Strategies recorded webinar. I'd like to start by sharing my screen with you as I take you through a presentation from the Royal College of General Practitioners 2018 annual conference. So welcome to all our members from across the sector we have with us today. I know this includes stakeholder groups such as the Department of Health representatives, GPs, nurses, allied health professionals, and most importantly, our health service consumers. Today we're going to be shining a spotlight on population ageing in Australia and the general practice sector. As I said, my name's Genevieve Daly. It's a pleasure to be here. So in this 15-minute spotlight presentation, we'll be covering the following topics. We're going to look at an overview of population ageing in Australia, the impacts of this population ageing on a micro, so a local level, and a macro level, looking at national impacts, ethical responsibilities of stakeholders, challenges and opportunities, and strategic responses. Finally, we'll summarise with a quick quiz just to keep you on your toes, see what you've managed to take away from the presentation, and then some questions and answers. So let's get started. So probably the most important thing we need to recognise when looking at this important environmental influencer is to keep calm and breathe. It's true, we are seeing increases in population, and we'll talk about that a little bit later. And this is mostly due to sustained low fertility and increased life expectancy. And yes, people are living longer, often with chronic conditions such as diabetes, heart disease, and kidney disease. But is this really the crisis policymakers and our media might have us believe? Let's find out. So here we have a snapshot of the ageing Australian consumer. And this pictorial representation helps us understand market demand. And understanding market demand means understanding consumer demographics and consumer demand. So we've looked at the BEACH, Bettering the Evaluation of Care of Health survey, and this was a survey conducted between 1998 and 2016 by the University of Sydney. And this study records and evaluates data collected by general practitioners regarding things like practice characteristics, patient demographics, and changes to management issues within the sector. So all very important information for us to have. And a review of the last decade of research has highlighted the following changes. So the population, as we've explored, of Australia did rise 17% between June 2006 and June 2015. This meant the population went from 20.6 million people living in Australia to 24.1 million. So that's a really big increase. We also saw the proportion of people aged over 65 increase by 33%. So that's from 2.7 million people to 3.6. Again, that's a really large increase. So 83% of the Australian population claimed at least one GP item. So this is also an increase of about 38%. And in addition to this survey, we've also looked at the Australian Institute of Health and Welfare reports, and that states that more than 11 million Australians reported having at least one of 8 chronic diseases in 2014 and 2015, and that 87%, so a vast majority of people aged over 65 had at least one of these 8 chronic diseases, and 1 in 3 problems managed by general practitioners related to these chronic diseases. So when we're looking at the Australian consumer, it's also valuable for us to look at the workforce. So what does the workforce that's managing this ageing population and their health concerns actually look like? So this, as you can see from the pictorial representation, the workforce supporting the ageing Australian population actually looks much the same as the Australian ageing population. So in the last decade, we have seen an increase in female general practitioners entering the workforce, but male GPs aged 55 still dominate this sector. Alongside this GP's profile, is a decline in the hours of working week that GPs perform. So we're only seeing 28% of GPs working a 40-hour week at this stage. So we want to know, how will stakeholders and consumers be affected by this increase in service demand and a decrease in workforce capacity? So we'll take a closer look at the environmental influence of the ageing population at a micro and macro level. The increased service demand resulting from ageing of the population has meant industry revenue, as you can see there, has risen by an estimated compound annual rate of 2.9%. This increase has meant that small-scale businesses continue to remain viable despite an influx of larger players in the market. This is essential as small proprietors are often tied closely to community need. Estimations of population prevalence continue to indicate rises in the diagnosis of chronic conditions such as hypertension, osteoarthritis and hyperlipidemia, with one study actually reporting half of patients attending general practice in Australia have 2 or more of these conditions. Increase in patients with complex needs does mean a triage approach, as you can see there, to service delivery will be essential. So GPs will facilitate care of patients at high risk of hospital admission, and there's the potential for delegation of services to other health staff such as nurses. And we're seeing that multidisciplinary approach to service delivery becoming more and more valuable. So looking at the national impact, while it's yet to be fully understood as this is an emerging influencer, federal government initiatives such as the Healthcare Home Strategy, whereby patients voluntarily enrol in a general practice and the payments to the practice are bundled according to the number of enrolments, are beginning to be rolled out across the country. The other issue is the restructuring of tertiary services such as emergency departments to service the overflow of patients from general practice. So increase in service demand has seen rises in emergency department presentations of non-urgent matters. Approximately 12% of presentations are considered non-urgent. And this includes management of chronic conditions. So Australians over the age of 65 are determined to have many more annual emergency department visits than younger Australians. So the reduced capacity of general practice and the increase in patient complexity is going to result in further strain on this already under-resourced public service. So health planning. So looking at the ethical responsibility of stakeholders, and as we've mentioned, stakeholders relevant to this industry do include general practitioners, but also consumers, practice owners, practice managers, allied health professionals, other service providers such as emergency departments, and government bodies such as the federal government and Commonwealth Government of Australia. So when we look at health planning designed to meet the needs of service demands in the ageing population, it's essential we have a strong focus on ethical responsibilities. And in an under-resourced, revenue-driven industry, patient-led care is paramount, and the utilisation of technologies such as e-health records and telehealth must be prioritised. Ensuring implementation of strict governance policies and mandating reporting of quality indicators such as patient health outcomes will be essential for delivering services in this potentially challenging environment. So let's look at some of the challenges and opportunities and strategic responses resulting from the ageing of the population and this increase to service demand. And you know, while it is understood that the Australian population is going to continue to age and that associated chronic morbidities may put increased strain on general practice, within this industry there are many opportunities despite some of these challenges. So strategies we're already beginning to see being rolled out is the implementation of this new federal funding initiative. We're also starting to see a refocus on preventative healthcare measures, and this will see benefits across the population and the labour market. So looking at lifestyle changes, diet changes, non-medicated responses to chronic diseases is essential to meeting these challenges. Utilisation of multidisciplinary service delivery models whereby general practices don't work as silos and they tend to employ nurses and other allied health professionals will meet service demands. Increased funding for research into technologies to manage chronic health conditions, workforce recruitment and retention incentives, particularly through universities and for overseas students studying in Australia, and then the effective monitoring and evaluation of these programs. The projected increase in service demand needs to be recognised as estimates only. As we referred to earlier, take a deep breath, stay calm. Effective future-proofing strategies such as the investments we've talked about, research and technology developments, mean that this important environmental influencer could actually be the catalyst for great change. So we're just going to go through a quick quiz now just to see if you've picked up the key messages that we've presented in this look at population ageing in the general practice sector. So just bear with me, we'll go through this quiz quite quickly. So question 1, what factors contribute to the ageing of the population? So I hear an answer over there. You're absolutely right. Sustained low fertility and increased lifespan. Well done. Next question. In the last decade, what was the increase in percentage of people living in Australia aged over 65 years? Sir, to my left? Yes, 33% increase. Population currently at 24.1 million. Okay, let's move on to the next question. What percentage of people aged over 65 have a chronic health condition? No one knows? That was a tricky one. 87%. The vast majority of people over the age of 65 are living with one of those 8 chronic health conditions. Now, name one local and one national impact of this environmental influence. Madam? Correct. Increased demand equals increased revenue. Lots of potential there. And changes to a national impact is the changes to Medicare funding allocations that we're seeing with our healthcare home strategy. So we've talked a little bit about ethical responsibilities, but just if you can name the priority of general practice sector to meet the ethical responsibilities of stakeholders, what would it be? In the front row? Absolutely. Patient-led care, an essential strategy for ensuring the ethical responsibilities are met. So after all of that, are we looking at the terrifying future the media predicts for the general practice industry? No! Opportunity, opportunity, opportunity. Things are definitely not as dire as we might be led to believe, and it is naive of policyholders to attribute under-resourcing of general practices and the primary healthcare industry as being attributed to just the demographics of the population accessing the service. Any questions? Fantastic. No questions. Thank you for attending today. Any comments, compliments or criticisms, please direct them to my email, gdally@hotmail.com, and I'll just follow with some references and further resources that you might like to access if you have a particular interest in this area, especially around some of the new strategies. They're all listed there. Great. So thanks for attending. Enjoy the rest of your conference.